Well, and welcome to Take 10. I'm Rob Nieto. Joining me today is Dr. Joseph Dello Russo, ophthalmologist. Welcome to Take 10, Doctor.
Thank you for inviting me.
Now, Doctor, I'm glad you could join us today because I know I was at the office earlier today and running through your schedule, I saw 12 surgeries taking place today, and the first one we saw was in cataract surgery. Why don't we go into that a little bit first? Tell me a little bit about that.
Cataract surgery?
Yes.
What a cataract is?
You've had a great history now. You've been a pioneer now for the last 20 years, and the surgery I saw performed today occurred in less than 15 minutes. Tell me a little bit about the latest surgery.
The latest surgery we call no-stitch cataract surgery, where you don't need any stitches because the opening is so tiny, the opening seals itself. Through that tiny opening of like 1/8 of an inch, you saw us remove a cataract with ultrasound, and then afterwards replace the cataract with an artificial foldable lens. That's the whole basis for the surgery.
Now, this would be considered a minimally invasive surgery, whereas the old surgery would have taken how long to recover?
Well, it's a lot more complex than that, but the most important thing is the wound. The wound in the conventional surgery is about 1/2 inch of a wound that has to be sewed up, a lot of stitches afterwards. It takes a long time really to heal. At the end of this operation with no stitch, the wound is like 1/8 of an inch, it closes by itself, it's all done.
Now,
next day you get up, you see, do whatever you want.
Recovery time now versus then?
Recovery time next day, you see fine.
That's wonderful. Now, we had the opportunity today to, like I said, go to the office, witness the surgery, and we also had several patients that we spoke to.
And my sister also had the surgery, and she's ecstatic.
Any advice for people who might be thinking about having the surgery?
Well, it was a piece of cake. Really, you didn't feel anything. As a matter of fact, while the doctor was, well, doing whatever he does, and I said, when are you going to start? He says, what do you mean? It's all finished. That's how fast it was. So it was really great.
Now, there's a risk of hospital-based infections increase the reason for having an outpatient versus inpatient operation?
No, that's the real downside of hospital admission, is the fact that you can get a complication, and the most serious of which is an infection, of course. But for the average person, it's convenience. Going to an outpatient facility like mine in my office, which I opened 20 years ago, and it's just very convenient. You come into the building, you have your surgery done in about 10 minutes or so, you go home. That's it.
Now, we did speak with the patients today, and we actually have video for that right now.
I'm here with Jenny Sabarina. We just finished the surgery, and Jenny, how did it go? Did you feel anything?
No feeling at all.
How old are you? Why don't you let everybody know? I know I'm not supposed to ask a woman her age. 90 years old?
Yeah.
You look very good. Does you look like you're in your 30s, 40s? You
know? Oh, no.
I had to guess. But you didn't feel anything?
I didn't even know when the 1930 went.
Oh, wow. So did you feel anything, or did you have any feeling?
No.
Did you hear the doctor singing?
I heard the doctor talking and everything.
Well, I can only say I had the most praise for cataract surgery, especially by Dr. Dello Russo, who I think is one of the best around. I've been coming here for years, and I find now that my life is easier because I can drive wherever I wish, especially at night. I had trouble driving at night prior to my surgery. And since my surgery, I've been driving at night, especially to New York City, and you know what driving is like in New York City.
Now, they were fairly energetic and enthusiastic about the operation. I was skeptical and I was scared going into it, but they were, if they can do it, I can do it.
Certainly can.
But when we come back, more with Dr. Joseph Dello Russo when we return. Stay tuned.